Oh, hello. My name is Dr. Paul Driscoll. I'm the Medical Director of the Suffolk GP Federation and a General Practitioner in Felixstowe in Suffolk.
Paul, can you start by telling us why it's important to you as a doctor to have access to the full record when you're seeing a patient?
So when I'm seeing a patient, it's really important to be able to be informed of what their past medical history is, what medication they might be taking, any reactions to medication they've had in the past. And when I see the clinical record, and there are only one or two computer systems generally used locally, so it's very familiar to me, I immediately get a sense of the patient and their medical history, and I can get information about their recent consultations with their GP and access to the hospital letters, and that enables me to form an opinion and diagnosis of the patient much more effectively than if I'm not able to have that information.
Okay, and for patients, how does sharing their record help them in terms of the consultation they have around their care?
So it means that I'm able to see the past medical history and the medication without the patient having to remember what they've had done and what medication they're on. Sometimes medication names are quite long-winded and difficult to remember, and the patient may not be feeling 100%, which is why they're seeing me. So the ability for me to see that all, checking again with the patient that the information is correct, is really helpful. Also, if I'm thinking of prescribing medication, the computer will automatically cross-check that against the medication that the patient is taking. So it makes it much less likely to make a mistake, or some drugs do interact with each other, or the patient may have an allergy that they've forgotten to mention, and the computer will prompt me with that. Some modern computer systems have got some diagnostic software in there as well, which may prompt me, for example, regarding a diagnosis of sepsis. So there are some safety features within that which make it beneficial for the patient.
Okay. Should patients be concerned about sharing their record?
No, I don't think they should. Data sharing in the NHS is controlled very strictly. Data is only shared between organisations who need to know that information about the patient, for example, clinicians actively involved with that patient's care. All staff working with the NHS are aware of the strict rules regarding data security and confidentiality for the patient, and that's taken very, very seriously. So I don't think patients need to be worried that their information is going to be abused. Audits are undertaken to ensure only the right people who need to look at that information are looking at that information. So I don't think patients have any cause for concern, and in fact it improves their patient care when other clinicians are able to see their records.
Can you tell us how sharing works within GP Plus itself?
So GP Plus is the service that provides extended GP hours for patients in Suffolk in the evenings and weekends, staffed by local GPs and nurse practitioners. When the patient arrives at the GP Plus site, they will be asked by the clinician whether they have shared their data whether they have agreed to share their data beforehand. If they have, the GP will check that that's still the case and will consult the patient with access to the record with all the benefits that I've just mentioned. If the patient hasn't up to now shared the record, which may be because they haven't been asked by their GP or it hasn't been necessary to do so, the clinician will ask the patient, gives them a leaflet explaining what it means and ask them whether they're happy to share the information there and then. The clinician then can adjust the record and click the data sharing on, and the option is either to share it with that just for that episode of care, or to share it with ongoing episodes of care, not just for that one-off episode. If the patient chooses not to share the information, it may be the clinician may not be able to see them and continue that consultation, and they will be directed to seek care elsewhere.
So if people want to find out more, how do they go about that?
So there will be more information in the leaflet you've been given when you are seen in GP Plus. You can look on the Suffolk GP Federation website, which has got the section on data sharing, or you could ask for some information from your own practice.
Okay, thanks very much for your time.
Thank you.